I serve on the Central PA MLK Day of Service Board of Directors, along with Mike Walsh, as well as Representative Patty Kim, as well as fellow members of the wider Harrisburg community. We're super excited for all of you to join us today. We've had a series of events throughout the day, everything from children's games, learning about MLK Day, to a session with authors and poets. And now we're shifting our focus to talking about healthcare right here in our community in Central PA. So we've got some great speakers lined up today. Emily from the United Way, as well as Deb from the Beacon Clinic. So at this time, I'm going to go ahead and turn it over to Emily to kick things off.
Great, thank you so much. I'm going to try to share my screen now. We'll see how that works. All right. Okay, does that work?
I do not see it, but I can share if you would like.
Oh, you know why? There, how about that?
There we go, we're rocking and rolling now.
All right, great. Well, I want to thank you so much for having me here to present at this wonderful event to honor Dr. Martin Luther King Jr. And I'm happy to have an opportunity to tell you about a program that is helping to improve access to healthcare right here in the Capital Region, Contact to Care. So a few years ago, the community leaders who direct the United Way wanted to change its way of operating to a community impact approach. The community and its leaders and agencies were surveyed to identify key areas to address to strengthen the Capital Region. As a result, United Way moved forward with a commitment to maintain support of basic needs resources in the community, but also began bringing together leaders in various fields to develop pilot programs to address health, education, and income, building an infrastructure to promote self-sufficiency within our most underserved communities. The main goal for the health initiative, called Contact to Care, is to improve access to healthcare. When someone has access to healthcare, they can get immunizations and preventive care to stay healthy, and they can detect and manage chronic conditions before they cause other health problems. To help with access, United Way funds community health workers, which I will explain in a little more detail in a minute. The community health workers meet with people who are uninsured or are having trouble connecting to medical care. First, if the person is eligible, they connect him or her to an insurance enrollment specialist who helps people find the best insurance no matter what provider that they can afford. Next, the community health worker helps the person connect to a medical provider. Depending on the person's insurance and location, that could be a federally qualified health center like Hamilton Health Center in Harrisburg, or Sadler Health Center in Carlisle, where they can use Medicaid or self-pay on a sliding scale. It could also be a private provider, or it could be one of the area's clinics, such as Beacon Clinic in Uptown Harrisburg, Community Checkup Center in Hall Manor, the Medical Outreach Clinic at Christ Lutheran Church in Harrisburg, or Hope Within in Elizabethtown. In addition to that, the community health workers teach people in our program how to use health resources most effectively, like making and canceling appointments, when to see their primary care doctor rather than using the emergency, and how to stop the spread of germs and viruses, which is a very important skill and information to have right now. Helping people with social determinants of health, which is a term that's used to describe some of the barriers to care, like transportation, language, food, and shelter, has become a very important part of the program, because if you're worried about those things, you're probably not going to be thinking about your health care. People who will benefit from the program are those who need insurance or are struggling to make that connection to health care. Think of people who don't seem to understand the process for applying for insurance, or people who start but don't complete the process, or people who have a lot of barriers that are keeping them from even looking into their health care. Contact to Care benefits the community one person at a time. Access to health care can help improve an individual's physical health by helping them to stay well with the immunizations and preventive care, as well as providing opportunities to catch and manage chronic conditions early before they turn into bigger and more costly medical problems. Good health also helps improve a young person's attendance at school, and for adults can help prevent them from missing days of work and help them have more productive years at work overall. Contact to Care helps promote overall better use of the community's health resources too, by helping people keep their appointments, helping them learn when to use the emergency room only when it's needed. Also, the program can help individuals financially by directing them to resources that help them gain insurance or other funding to help pay their medical costs. And I like to take this opportunity to share this story, this adorable little boy. He is one of the people that we helped because when you avoid when you're able to afford medical care, you're avoiding medical debt. And this young man needed surgery to correct a medical problem that was interfering with his speech development and school performance. Our community health worker helped his mom, who doesn't speak English, with pulling together all the documents she needed to apply for emergency medical assistance and charity care from his providing hospital. So with the help from Contact to Care community health worker, his procedure was actually paid for, and he will also receive a year of free speech therapy from the provider. And because of Contact to Care's other services, they'll even have transportation to those appointments. So that's an example of how the Contact to Care program can really help a family stay out of medical debt and begin to move along and become self-sufficient. To put the program together, United Way used a collective impact model, and they created a steering committee. We call it our core solution partners around the table. Each partner plays a role in the program and participates in meetings to continue to monitor and direct the program, which got on its feet in November 2017 with 3 community health workers employed through Hamilton Health Center and working in the Allison Hill neighborhood. The Contact to Care community health workers are really the key to the work. They are the heart and soul of this project. The people in this role have a passion to serve their community. And because they live in and reflect the community they serve, they're able to earn the trust of community members. They have become experts at navigating the healthcare system, and they are knowledgeable about resources in the community so they can direct people they serve to get the resources that they need. More than half of our program participants in Harrisburg are Spanish speaking, and that's reflected in our team. In addition to English, we have also connected with individuals who speak Nepalese, Urdu, Arabic, French, and Hindi, to name a few. Right now, our team covers the greater Harrisburg area, including the West Shore and Mechanicsburg portion of Cumberland County and Perry County. Our community health workers are employed by Hamilton Health Center, UPMC Pinnacle, and Sadler Health Center. We're also working towards having a community health worker employed by Penn State Health. But the employers and the type of insurance that a person chooses doesn't matter. The community health worker is really there to help people get them connected to the health care they need wherever that works best for them. The Contact to Care community health workers are supporters, encouragers, and connectors to resources. They are all about building trust and making connections. Some of the program participants that we work with have never even used the healthcare system before. So they need assistance with basic things like how to make and cancel appointments. Where do I go to get an ID card? What documents do I need for different applications? Overcoming barriers, those social determinants of health, are an important part of this, because if you're hungry or don't have housing, healthcare isn't going to be a priority. The community health workers help make those connections for resources in the community. To assist with that, we have a connection plan that the community health workers go through with program participants that really helps them identify some of those barriers to care, and together they set goals around addressing them. The connection plan becomes the basis for their work together. And in addition to contacting the individual with reminders and encouragement, the Contact to Care community health workers also check in quarterly just to make sure nothing has changed and there are no new barriers to care for that individual. Something we're able to do because of the community donors who fund the United Way, when we're working with someone who agrees to be a program participant but who cannot gain health insurance, we can provide vouchers for certain types of care, including urgent dental pain and preventive dental care, psychiatric evaluation, therapy, and medication management, and eye exams and glasses. In addition, we can provide transportation for program participants who don't qualify for share ride or medical assistance transportation. Another important piece of the program is providing that basic education on health system navigation, including the appropriate use of the emergency room, making appointments, and stopping the spread of germs. This is just one example of some of our educational pieces which we provide. Since the beginning of the program, our team has helped 815 individuals connect to a primary medical home, 545 individuals get enrolled with insurance, and 2,010 individuals connected to various services within the community. What does that mean in terms of real people? Those are the stories that we love to tell. For example, we have a community health worker that was talking to a nurse in the West Shore School District. The nurse was concerned because she had 30 children who didn't have coats for the winter. And our community health worker tracked down a resource to make sure that the nurse could give coats to those kids. During the pandemic, one of the things we've done through a collaboration with the Central Pennsylvania Food Bank is we have access to emergency food boxes. So the community health workers were calling people who tested negative during some of the mobile testing, but they also reached out to people who tested positive to see if they were food insecure. If they did not have a secure food source and needed to quarantine, the community health workers would deliver food boxes to those individuals. And in one instance, that was an opportunity to educate a woman who needed the emergency food boxes about contacted care. Sure enough, she ended up in the emergency room due to complications from COVID, and she needed to be able to make a follow-up appointment with a primary care physician. So she called contacted care. Not only was our community health worker able to get her connected to a doctor, she also was able to help this woman get back on track with her mental health care services, and also was able to refer her preschool age daughter into our Ready for School, Ready to Succeed program. Other examples, we have a community health worker who continues to check in with a amputee who's living on second floor apartment and has a very limited support system. So she's one of those people that's checking in on him just to make sure nothing falls through the cracks. And another example, one of our community health workers who really works with the homeless community, she was able to help a man verify that he did have insurance, helped again by just constantly looking for him, was able to set up an appointment so he could see a doctor and get a prescription for an inhaler because he has asthma. She was also able to get him an appointment to have his eyes evaluated and get a pair of glasses, which he hadn't had for a long time. And he was just thrilled to be able to see clearly with his new glasses. So since the pandemic started, we have had to pivot to virtual work, but our community health workers have used this opportunity to continue working with the community, checking in on their existing program participants, and also supporting some of those efforts in the community, such as the COVID testing and helping people understand how to prevent the spread of COVID-19. They are also helping their program participants learn how they can get vaccinated against COVID-19. And I've included a link on this slide for that connection in case anybody who's watching this is interested. They have had to continue as an encourager to keep people connected to their healthcare providers. This is not a time to stop managing chronic conditions or to get vaccinations. All of those things need to continue, and they help encourage their program participants and help them over barriers to doing that. And they're also continuing, especially checking in with their program participants to see if they are experiencing new barriers due to the pandemic. Through contacted care, we're improving lives by empowering people and showing them a path to self-sufficiency with their healthcare. This is obtainable when individuals are connected to the right resources, guided to overcome barriers, and supported along the way. This is how people who donate to the United Way are helping create brighter futures for individuals, families, and the Capital Region. So how can you help improve access to healthcare in our community? First of all, help us spread the word. If you know someone who doesn't have insurance and is struggling to make those connections to get the care they need, encourage them to reach out to Contacted Care. The number and email above will get them in touch with a community health worker to get started with the program. Something else you can do, you can talk to your friend group or coworkers or other groups that you belong to about making kits for our program participants, little half-gallon size bags full of shampoo and soap or dental supplies, or a little first aid kit with a thermometer and Band-Aids and other helpful items. These are things that are often not covered by SNAP benefits and aren't as easy to access. So if you wanted to do a virtual get-together to assemble those packages and donate them to the United Way so we could get them to the community health workers, that would be a great activity to do. Or if you feel so moved, you can check with on volunteer opportunities with some of the free clinics in our area. They can always use a helping hand. And finally, your financial support is always appreciated. This program is funded through the United Way of the Capital Region, which is donors, regular community members like you and me, who are making contributions. So if you haven't already, think about making a contribution of any size to support the program. As an example, just $50 can cover the cost of a preventive dental exam or tooth filling. Contact to Care is truly a community effort, one that has brought all of the area's healthcare systems and clinics and other agencies together to collaborate to improve access to care for the health and well-being of our communities. So I thank you again for your time and attention, and I just appreciate the opportunity to be here to tell you about this great program. Thank you.
Awesome. Thank you so much, Emily. We did have one question that did come in via chat. And are the kit contents available on the website?
If they are not, we can get them to you. If you, you can go to the United Way of the Capital Region's website and look for Contact to Care, and you'll be able to find a contact for us, and we can get you the kit contents.
And as someone who's personally done the kits before, it's a great, team building, activity as well. Even like you had mentioned, like in a virtual setting, it's easy enough just to pick up a couple items at the store and everybody jump together on a Zoom call or a Skype meeting and putting the kits together. So again, thank you very much for sharing today.
Yeah, I'm trying to unshare.
No problem.
I apologize. I can see it, I just can't access it. Hold on.
Should try at the bottom of your screen, you should see an option.
I think what I'll do is leave the meeting and come back. Would that help?
That may work.
I'm so sorry, hold on.
That's okay. If you just want to exit out of the PowerPoint, but at the bottom of your Zoom screen, you should have an option to stop sharing.
I see it.
It may be hidden behind like the PowerPoint. There you go.
Yay, sorry about that.
No problem. Easy enough to troubleshoot. So great. So at this time, I'm going to turn it over to Deb to hear about some of the great work that she and the volunteers are doing at her clinic. Oh, Deb, I think I've got you on mute.
Okay, I'm going to try and successfully screen share and talk a little bit about Beacon Clinic. And if it doesn't work, Marissa, I'm turning it over to you to do so. So I'm going to give it a shot.
Sounds good.
Okay.
We can see it. We're in good shape.
Awesome. All right, so Beacon Clinic for Health and Hope is a free clinic for uninsured adults 18 and over, and we provide free primary medical care and free medications. Let me see if I can get it to advance. Oh, there we go. It's playing. Okay, so we are predominantly a volunteer-led organization. We have two staffers, myself and Kay Huber, who's the woman on the right of the tall gentleman in the center of the picture. Truly, Martin Luther King empowered other people to do for others. And so that is exactly what this core group of people do. We actually have a list of over 40 volunteers of different types: doctors, nurse practitioners, registered nurses, eligibility screeners, and receptionists, and people to work in our dispensary here. It is a formulary medical dispensary, and it is very meaningful. Last year, we've been able to provide over 3,000 or 3,400 medications to people, including insulin for diabetics. So as Martin Luther King inspired others, I wanted to tell a little backstory of how Beacon Clinic got started. You know, a lot of people figure when they're in their 80s, they're going to be kicking back, relaxing, you know, maybe going for a walk with their friends. But Ruth Stoll in her 80s had always seen this gap need for healthcare for people without insurance. In her 80s, she gathered her friends around to create Beacon Clinic. So she pulled together lawyers and engineers and other physicians and nurses and said, hey, let's see what we can do to make an impact. So it's kind of like a grassroots movement, solely funded by the kindness of others, grants and foundations. And we are part of the Contact to Care program, as Emily shared. Love being part of that Core Solution partnership. So we are a faith-based clinic, and we truly just show the love of Christ in action every day. So the people on the far left of your screen are Dr. Dave Froelich and Kay Huber, along with Ruth, and those three people were one of the primary founders of the organization. You'll see on the right-hand side a picture of myself with Patty Kim at one of our annual fundraising dinners. Patty does support what we do here at the clinic, and it's really important to get the word out. There's so many of her constituents who need our help. We also want to raise up the next generation of providers. We are a collaborative resource for many organizations. We get senior nursing students from Messiah University. We get senior nursing students from York College. And we have an ongoing program with the Penn State College of Medicine. The young folks that you see on the lower side of the screen are actually up and coming physicians, and they spend a year with us. Every year we have two medical students that spend the year with us, and it's really, really important to make sure that we create a legacy. Beacon Clinic is still fairly new. We're just going to be turning 6 years old. So getting the word out about who we can serve is so important, and the services that we provide. We do have, like I said, a lot of people volunteering here. We do a lot of community outreach events in the non-COVID time. So a lot of the pictures you are seeing are those times where we were unmasked, and able to do the outreach. So Kay Huber is our primary nurse practitioner, but the young lady that you see working on this gentleman is, she was a resident who now volunteers as a medical doctor for us. And she is awesome. Her name is Leisha Helm, and she also orchestrates many of the medical students and residents to do a food as medicine program here with Beacon Clinic. We're in our 3rd year of that. So we like to say that we are treating the whole person. A lot of caregiving in a primary care setting is creating that trust relationship with our patients so they feel comfortable to share about their life stories with us and be compassionate listeners. But the Food as Medicine program, we have been providing through grants that the students have been writing through Penn State to get really healthy food choices. We have 73% of our patient population are people that are managing chronic illnesses. And part of managing a chronic illness is eating well. So several times, in fact, we just did one last Thursday where we gave outreach of fresh fruit, vegetables, whole grains, really healthy food choices with recipes so people would actually know how to work with them. Many of our patients come from different countries. We have 43 countries represented by our patients. We like to say that we do deliver culturally competent care here, and people are speaking 26 different languages. We've been able to take from the leadership role of United Way with the Siricom translation system. We have that available, and we have multilingual volunteers as well. We have 2 volunteers that speak Spanish now and 2 volunteers that speak Arabic. We do have a heavy population of patients speaking those languages. We want people to feel comfortable no matter where they're from. They're going to be welcome here. It is a very inclusive environment. And as Martin Luther King would say, everybody can be great because anybody can serve. So whatever anybody's passion is, there's a role to play in our community. And all labor that uplifts humanity has dignity and importance and should be undertaken with painstakingly excellence. And that is what we are striving to do here, is to provide excellent care. Not only do our diabetic patients get those food options, we also provide them with glucometers and blood strips and alcohol preps. And if they need insulin, they get syringes or insulin pens with the pen tips. Absolutely everything they need to take care of themselves. If somebody has high blood pressure, we are giving them blood pressure machines to take home to monitor and call in with their results. We are doing video health appointments as well, and telehealth, and we are actually seeing people outside. Due to COVID, we are still being restrictive on how many people come in the building, and only as needed. So I'd like to tell a little bit of the stories, just like Emily did. The stories really make it real. The picture on the far left, if you notice the gentleman with the bucket on him, he's an amputee, and the woman kneeling down is his corrections officer. And he was recently released from incarceration when this picture was taken. And this gentleman suffered from diabetes, had to have his leg amputated while he was incarcerated. And because of his particular situation, no other clinics were taking him. She called and was like, we need to get this man insulin. We need to get him some help. Will you help us? And we, of course, opened our doors to help him. He wanted to come and give back. So they brought flowers, and this man weeded our garden. So, and put down mulch and planted flowers. And that is the joy of him receiving the care that he needed. He wanted to give back. And that was so moving and touching to me personally. We have been offering flu shot clinics here every year. This year we did a drive-by. Some people got a flu shot while they were driving through in their car, and some people would sit under a tent and get a shot. Another partnership with Penn State Health and then UPMC also gives us vaccines to give to our patients every year. The picture in the upper right, again, was when we could actually do one-on-one nutrition counseling and education with our diabetic and chronically ill patients, which is so important. People need to know how to care for themselves. And the first thing that I think they personally need to know is that they matter and they are worth the work. Sometimes when you have chronic illness, you just figure it's too much work, I'm not going to do it. But we are here to inspire hope, health, and well-being. And we want people to feel good about themselves so they will take care of themselves. That way their lifespan, is enhanced, as well as their quality of life. As far as doing things with excellence, I did want to just point out that Beacon Clinic, being as young as we are, we received a Buena Salud Award in 2019 from the Latino Connection and Aetna for our work with the Latino population here in the area. We have many, many Spanish-speaking patients, as Emily had alluded to. Several of the people coming through Contact to Care, and some of those patients from Contact to Care come into Beacon Clinic. We were also extremely honored to be selected as a top 5 nonprofit in Central Pennsylvania for health. We were, put on the same playing field as a group like New Hope Ministries and the Water Street Rescue Mission down in Lancaster, and Arch Street Center and Alder Health Services. I call them all out because they all have excellent standards. And the fact that Beacon Clinic has been seen in that type of a platform, have people be comfortable to come here knowing that they will receive quality healthcare from legitimate quality doctors. I've had so many people who've come in and toured our facility mention how clean and organized it is. And we want that for the people that come here. Everybody deserves that dignity of quality care, whether they can afford it or not. And that is what Beacon Clinic is all about. I'll share here quickly that we are accepting new patients. With so many people losing their jobs and their benefits, I mean, if you've lost your job, having COBRA benefits is terribly expensive, and people are easily falling at that 200% of the poverty level and under, and predominantly those are our patients, people in the poverty level, 200% and under. We do a small eligibility screening, nothing intense. We just need to know people's true situation and that they are residents of our area. We've actually had somebody drive up here from Virginia wanting care. People from New York wanting to come down here to get free care. We do like to serve, we serve Cumberland, Perry, and Dauphin counties. Our hours are listed there, and appointments can, if somebody wants to call in and schedule a time to be seen, we do ask that they call ahead, and we'll do what we can to provide the best care possible in their situation. Some of our collaborative partnerships are allowing our women to get free mammograms, our men to get free prostate cancer screenings. In addition to the Food is Medicine program this year, as one of the very first free clinics to have the opportunity to provide free fit kits to patients who might be in that profile where they really should be getting a colonoscopy, but this is a precursor, just a real easy swab to mail into a lab. If a positive result is shown, we are able to provide them through the gift of Hershey Medical Center, a full colonoscopy screening from Hershey Endoscopy. If that person needs to have surgery, they can get free surgery and follow-up treatment, whatever that might be, as part of this particular program. So we are honored to have been chosen for these types of services to provide to the community. And we are here for all of you. If you need us, please call and we'll do our very best. And if you just need to have that referral off to get insurance, that's something else that we do here as well. We have a partnership to get that taken care of. We've had about 2 or 3 people in the last year that needed referrals for emergency Medicaid because they had advanced situations such as cancer that needed to have additional increased services beyond our realm. And we do those warm handoffs to get people the services that they need. Thank you for the time to share. If anybody would like to donate to Beacon Clinic, you can do so through our website at beaconclinicpa.org. And thanks, Marissa, for having us.
Thank you very much, Deb, and thank you, Emily, as well. Enjoyed hearing, some of the great work that both the United Way and the Beacon Clinic are doing right here in Central PA, right in our backyards. The overall theme for today is neighbors helping neighbors, and I think what you both had talked about is definitely spot on with what we're trying to achieve here, not only today, but every day, moving forward. I definitely like to, at this time, open it up to any questions that individuals have on the call for either Deb or Emily. So feel free to use the chat feature or go ahead and take yourself off of mute and ask your question.
Oh, I want to share one more thing. There's actually going to be free COVID testing at our location on Wednesday. One of our community partners, Hamilton Health, is going to do that for free from 10 a.m. to 2 p.m. They just ask that you call to schedule an appointment, and I'm going to put that phone number in the chat.
That would be great. Thank you. And we did have an earlier question, but I'll make sure that everybody did get to see the answer since it was in chat. So I think this is for Deb in particular, but where is the medical outreach located? And Deb's answer was, so the Beacon Clinic is located at 248 Seneca Street in Harrisburg. And then Emily, if you'd like to just kind of throw out with the United Way where the main office is located, and then you could just remind everyone where United Way provides services to, that would be great.
Sure. So United Way offices are actually in 2235 Millennium Way in Enola. And our website for information about all of our programs is uwcr.org. Contact to Care is located, or the community health workers work out of the different federally qualified health centers in our community. That's Hamilton Health Center in Harrisburg and in Newport. And then we have a community health worker at UPMC Pinnacle who's in Harrisburg, and a community health worker with Sadler Health Center, and she serves the West Shore and Mechanicsburg area.
Awesome. Thank you very much.
Hey,
Any other
Marissa,
questions? Looks like
yeah, I
I
got a question
always
for
has
you.
a question.
I do. I put it in the chat box earlier, but some of the, I think practically some of these things were touched on with like contact information for all the programs and ways that people can get involved. But I'm wondering, particularly around health, this tends to be full of confidentiality. And for a community to be involved in that process of getting people help can be tricky. So I wonder what your thoughts are about how neighbors can help their neighbors. What, given all of the issues of confidentiality and individuality that face our health system, how can neighbors get involved? I'll just give you a really practical example. It snowed, that big snow we got the other day, a couple weeks ago. I was profoundly aware that on my block, there were 4 people, actually 4 consecutive houses just up from my block, of folks who were either coming out of surgery, were ill, or were elderly and could not shovel their snow. I only knew that because they're my neighbors and we actually talk. But there's often lots of people don't know their neighbors. They don't know what's going on right next to them. So I was just wondering if you had any thoughts creatively about how neighbors can be more involved in the health, not just of their community, but of the people right beside them.
Well, I'm going to speak for just a second. I know that, I live in the city of Harrisburg myself, and I know that like the Midtown residents would post, hey, somebody needs help. Not everybody wants to be vulnerable and ask for help. And I think if you see there's extra snow laying out there, maybe somebody's not neighborly. Some people are very closed off to the rest of the world and are not willing to share, like I said, and be vulnerable that maybe they need help. So the only thing I could do is just say, take action. I knew that there was a neighbor across from me that was hurting, and I had a couple extra food bags back in November. I had no idea this woman just got out of the hospital from a heart health crisis and couldn't get to the store. And me bringing those groceries to her, just as a kind gesture, I was able to find out that she had a situation. And sometimes it's really just you doing the outreach to people that you might think have an issue, and that's important. When people get referred over here for healthcare when they didn't have any, a lot of them are just truly ashamed that they need services. But this is, you have to provide that guilt-free zone for people to feel safe with you.
And I would just add on to that, Chad, I think that your inclination, I think the secret is to be neighborly, to talk to that person, even if you're just saying hello and noticing something and striking a small conversation. So you do know your neighbors, you'll be more likely to know what their needs are. And then you can be an encourager, just like our community health workers are encouragers. More people who participate in things like today's event to know what the community's resources are, then you can help encourage someone who seems like they are in need of something to take action and get that resource. We have a wonderful resource called 211 that anybody can access if they don't know, if they have a need and they don't know how to address it. 211 is a great place to start. If someone needs just someone to talk to, you can call 211 and have somebody at the end of the line to talk to for a little bit. So that is a great tool for you, just being neighborly, running into someone who has a need without getting too far into their detailed medical history or information they might not want to share. You can at least make them aware of that resource very easily. It's easy to remember. So that would be something I would suggest.
Yeah, thanks to you both. I really appreciate that. Deborah, your comments about the difficulty of vulnerability. I think for me, it's hard for me to be vulnerable, but I shouldn't ask of somebody else if I'm not willing to do that too. If I need help, I need to be able to ask for help. And Emily, I can't tell you how many times I've used 211. It's so helpful to be able to share that with people who are asking questions. So thanks to you both.
Great. Thanks again, Chad, for the question. So again, anybody else, feel free to either take yourself off of mute or submit a question via the chat. While we're potentially waiting, I would just like to say again, we're so thankful to have both Emily and Deb with us, on today's call. I found the discussion to be honestly kind of like inspiring and truly kind of motivating, as we move forward here on MLK Day of Service, and something that we can continue to work towards, as we continue on in 2021.
Thank you.
It's a real pleasure. Thank you so much for having us and letting us share about our programs.
Great, thank you. And for those who may have dialed in a little late, we will be sharing the recording of today's session on the Central PA MLK Day of Service website, as well as on our Facebook page. So then you'll be able to kind of share with your neighbors, coworkers, family, and friends, just so we can get the word out more about some of these great programs. And then coming up here right at the bottom of the hour, at 2:30, we are going to have a discussion on homelessness here in the Harrisburg area. So if your schedule permits, we'd love for you to attend that discussion as well.
Okay.
Again, thank you all very much for your time, and have a good rest of the day.
All right.
Thank you.
Thank you.